Welcome back to our series, Conquering Candida. Today I'm going to be discussing Chapter 5. This is actually my original Dr. Mitchell's protocol for treating Candida. I like opening with a quote from the comedian Eddie Cantor. It took me 20 years to become an overnight success. And I can relate to that because in treating Candida patients in my early years, it was quite difficult. So I wasn't always sure what I was doing was correct. But over the years, I've gotten a lot more confident and seeing the results with so many patients getting better. So, what is the protocol for treating Candida? It really rests on 4 pillars. It involves the diet, it involves antifungal medications, it involves vitamin therapy, and lastly, I like to use my Candida sublingual immunotherapy drops. So, we have heard for a long time, and there are a lot of misconceptions about Candida. In Chapter 10, I will be discussing, and in the video series, I will be discussing with my co-author, Joelle Mitchell, how to best adhere to the 30-day Candida diet plan. Our goal is not to punish you. We want to make you feel good and have options. In the first 30 days of the diet, we do ask you, though, to restrict processed sugar. We ask you to limit the amount of bread and especially wheat-based products. We ask you to try to minimize the grains. We also ask you to try to limit dairy. And of course, really during this period, no alcohol is allowed. What I do allow, and I strongly advocate for, is to eat low glycemic foods. These are foods that do not raise your blood sugar because Candida in your body likes to feed on sugar. So for example, the low carbohydrate fruits that I like are apples, berries, grapefruit. I would encourage patients to eat the healthy, unsaturated fats such as nuts, seeds, avocado. As far as proteins, good quality protein, fish, meat, and poultry are all good choices. It's also really important, as I mentioned earlier, to have a lot of fiber in your diet. Fiber I call the good carpeting for your gut. The microbiome likes this, so that's why I strongly recommend to my patients all the time ground flaxseed, cruciferous vegetables. These are all good things for your gut. What I do also always caution patients is that no fermentable foods. For some reason, people hear a lot how great fermentable foods are for them. That doesn't really apply to Candida patients and in fact can make them worse. The second part of the protocol of treating Candida involves antifungal medications. This is so important. I know that patients and doctors have so many misconceptions and are apprehensive about using antifungal medications, but they can be used safely and very effectively. One of my mentors, Dr. Marjorie Crandell, a researcher in Candida, had a very famous mantra, which she said on my podcast, The Smartest Doctor in the Room: you can't cure Candida with diet alone. And I've seen that in my own practice. I've had patients that have followed the Candida diet incredibly strict for months or years, and they are slightly better. But once they are treated with the appropriate antifungal medication for the appropriate amount of time, they see dramatic improvement. This was the case, as I mentioned earlier, with Erica, who came to see me from New Mexico. She totally transformed when she was treated with the right antifungal medication. The next phase of the protocol treatment involves vitamin support. Now, I've learned the hard way when I initially was treating patients for Candida, where I went immediately to the antifungals. A lot of these patients would experience something called die-off reactions, or the Herxheimer reaction. It's an uncomfortable reaction where actually a lot of your Candida symptoms can flare up and you feel terrible. Now, it doesn't last for a very long time, but it's very discouraging and makes patients doubt whether they should continue with the treatment. I've found that over the years that by doing IV vitamin support with high-dose vitamin C and glutathione to cleanse the liver, that I'm able to avoid this in many situations. One of my mentors, Ann Borick, who is a naturopath out in California, was the one who tipped me off to this, and I'm greatly appreciative because she was right. One of the other things I like to always explain to patients, because they have concerns, they always want to know why they can't just take oral vitamins. And what I explain to them is that unfortunately oral vitamins are not well absorbed from the intestine, around 1%. And this just isn't enough typically to help a patient that needs intensive Candida treatment. So that's something that I recommend for patients if they have access to. The fourth and final component of my protocol to conquering Candida involves Candida sublingual immunotherapy drops. Now, I am fortunate that my background is in allergy and immunology, and over the years I've desensitized thousands of patients to environmental allergens and in the last decade to severe food allergies. It's a very safe therapy, it's a natural therapy, and it essentially gets your own immune system to build up tolerance. I've also been doing during that period of time Candida sublingual immunotherapy. I'm excited because I find that the Candida sublingual therapy boosts the patient's own immune system, and the benefits are that the patients don't need to be on antifungal medications for long periods of time. It also helps them expand their diet so they don't have to be so restricted when they go out with friends. The treatment works by building up their immunoglobulin levels. It's an easy thing to do. The patients take these drops at home. It's just a few drops each day, and over a period of a year to 2 years, they build up this protective immunity. Eventually, the patients are able to stop the immunotherapy drops themselves and go on with their life. If you've liked this episode, please like our episode on our YouTube channel, The Smartest Doctor in the Room, and hit subscribe.